9 out of 10 veterans believe they should continue to receive the same quality of anesthesia care available to civilians in the nation's top hospitals. But according to a nationwide survey by the American Legion, a new proposal would replace anesthesiologists with nurses in surgery and could actually endanger veterans' health and lives. Here to talk a little bit more about this issue is Dr. Ronald Harder and Dr. Bridget Bush. Tell us a little bit about the VA proposal to move to a nurse-only model of anesthesia care, and how would this impact veterans?
Thank you very much for that question. We feel that it's important that all Americans, and certainly especially our veterans, be aware of this proposal that's being considered by the VA. The model of anesthesia care that's been in place in the VA for decades has been a physician leading the anesthesia care, either by delivering it themselves or by supervising a nurse anesthetist. This proposal would remove the physician involvement in that anesthesia care and go to a nurse-only model. That model is used extremely rarely throughout the U.S. All of the leading hospitals in the U.S. use the physician-led anesthesia care team model. And the veterans themselves recognize that they want to have anesthesiologists involved in their anesthesia care. A recent survey by the American Legion showed that 9 out of 10 veterans surveyed do want to have anesthesiologists involved in their care.
Would moving to a nurse-only model cut costs or actually help with anesthesia workforce or access issues?
Thank you for that question. No, in fact, it would not. Anesthesia care is the same cost, whether a nurse anesthetist or an anesthesiologist is providing the care. Additionally, independent research has shown that anesthesia is safest when an anesthesiologist is involved. The VA's own data shows that there is no anesthesia workforce nor access issues within the VA. As a veteran and an anesthesiologist, I know the importance of teamwork. The military teaches us that everyone brings their own independent skills, strengths, and experience to create mission success, and anesthesia is no different.
What is the difference between an anesthesiologist and then the nurse coming in to do the same work?
Thank you for that question, because it is an important distinction. Anesthesiologists are physicians who have attended medical school and residency, and in many cases, a fellowship following residency. They attend twice as many years of education as a nurse anesthetist. And as far as the clinical training goes, they have 5 times the hours of clinical training that a nurse anesthetist receives. And beyond that, the training and education that an anesthesiologist receives is built upon learning the practice of medicine and being able to recognize and treat medical issues that can arise before, during, or after surgery. Nurse anesthetists are outstanding nurses, and they're a tremendously valuable member of the team, but they are not substitutes for physicians. Their training is really built upon following the lead and the direction of a physician in the care of patients.
And what happened back in 2017 when a similar change was proposed?
Back in 2017, after an extensive multi-year review, in which the VA solicited comments from key stakeholders, as well as received 200,000 comments on the Federal Register from the public, including 50,000 from veterans and veterans' families. And after all of this review, they decided to maintain physician-led care. So there really is no need nor justification to repeat any of that and go back on that good decision that they made back in 2017.
And finally, what can Americans do to help protect veterans' health and safety?
Thank you. That's an important message that we want every American to go to safevacare.org. That is a website that will provide more information and more details about this dangerous policy that's being proposed, and it provides the opportunity to submit comments to your legislators so that they can communicate to the VA their opposition to their consideration of this very risky and unnecessary proposal.
Thank you so much.
Thank you.
Thank you.